Welcome. Thank you so much for joining us this morning. This is the Canon Hospice Radio Hour. My name is Elise Spencer. I'm a community liaison for Canon Hospice, and so grateful to Mississippi Media for this opportunity to bring information to the community about relevant healthcare issues. This morning we are joined by Dr. Candace Worsham. Dr. Worsham is a board-certified physician in family medicine and osteopathic manipulative medicine. She is a former graduate of Jackson State University in Jackson, Mississippi, where she received her Bachelor of Science degree in biology. She attended medical school at Ohio University Heritage College of Osteopathic Medicine in Athens, Ohio, where she obtained a doctorate of osteopathic medicine, or DO, degree. She completed her internship and her residency at Doctors Hospital in Columbus, Ohio. Dr. Worsham is a Mississippi native, and she takes pride in her hometown of State Line, Mississippi. She's excited to return to her home state to practice family medicine in Gulfport, where she's recently taken over the practice of the late Dr. Joseph Faison and takes pride in serving this community as well. She's an active member of the American Osteopathic Association, Mississippi Osteopathic Medical Association, the American College of Osteopathic Family Physicians, American Academy of Family Physicians, and the Mississippi Academy of Family Physicians. She works with the National Health Service Corps. In her spare time, she enjoys spending time with family, participating in church and community activities, and cooking, traveling, and teaching. Dr. Worsham, welcome, and thank you very much for participating in our radio broadcast today.
Good morning.
This morning we're going to be talking a little bit about high blood pressure and hypertension and understand how prevalent this is in our American society and specifically to our population here in Mississippi. We're going to be talking about ways to identify when blood pressure is elevated, some of the treatment protocols for high blood pressure, and just help our listeners understand a little bit better how this may affect them and those they love. Dr. Worsham, can you tell me a little bit more about hypertension? What are the signs and symptoms?
Well, sometimes the signs and symptoms of hypertension go undetected or unnoticed, but some of the common signs and symptoms are fatigue, vertigo, dizziness. Some people may complain of chest pain. Others may complain of palpitations, as if the heart is racing. There may be numbness or tingling. Some people may have a headache with or without throbbing.
Okay. So it is possible that a patient may come into your office and think that they have perhaps a heart problem. Some of these symptoms would mimic a cardiac condition. Would that be right?
Absolutely. That's why I always encourage others to go to the doctor or find a doctor in our local area who can detect high blood pressure or hypertension. Because as we all know, about 50 million people are diagnosed with hypertension in our United States of America, and about 1 billion are worldwide. As our population ages, we will see an increase in prevalence of this illness. The blood pressure relationship and cardiovascular risk in many of the research journals suggest that there's a continuation or a constant relationship that are independent of other risk factors. In our offices here in the United States, hypertension or high blood pressure makes up about 35 million office visits. And unfortunately, about a third of our population are hypertensive or have high blood pressure and do not know. So it's a very scary illness.
So in many circumstances, a patient may not know that they have high blood pressure unless they come in on an unrelated matter or for a routine checkup. Is that right?
That's correct.
Do you see a certain number of patients that are pretty surprised by their blood pressure reading?
Yes. In my practice here in Gulfport, Mississippi, I see patients ages 13, and my oldest is 103. And out of my patient population, I would say about 50%, maybe 60% have hypertension or high blood pressure.
Really? That's a pretty shocking figure when you stop and think about that.
Absolutely. And what I'm seeing is with hypertension, it's not only in the middle age or elderly. I'm seeing the diagnosis in our 20 and 30-year-olds as well.
So for those people who have an elevated blood pressure when they're in their 20s and 30s, if this goes unchecked for a long period of time, this has a lot of implications for them in later life in terms of affecting their cardiac health, their organ systems, and so forth. Is that true?
That's true. The key is if you can detect hypertension in patients in their 20s and 30s, then you detect it early, and we can do something about it earlier than later,
Okay.
so that we can eliminate the target end organ damage that we see with hypertension in later years.
Can hypertension be effectively controlled and managed through medication alone?
The first thing I suggest in patients with high blood pressure or hypertension is let's start at the root. And the root is lifestyle changes, which include a healthier diet as well as physical activity. And when I talk about diet, the focus is more green or veggies, more fruits, low-fat dairy, high fiber, less or minimum salt, if any. To start with physical activity, my suggestion to them is most days of the week, that is 4 to 5 days, of 30 minutes of aerobic activity. For example, brisk walking or treadmill or the bike, cycling, those types of things. Even swimming, which is more effective with the joints, less stress on the joints. And that's 4 to 5 days per week for those things. So with physical activity and diet together, that can effectively lower blood pressure. But there are others who, again, have a family history of blood pressure problems and other risk factors that may need therapy with medication, whether that be monotherapy or more of a fixed dose therapy with more than one agent.
So when you see a patient in your office, the first course, as you say, would be making some lifestyle changes. If their blood pressure is only moderately elevated, would you start first with that and then plan to do a follow-up to reevaluate?
Well, when I see patients initially in the office and they have an elevated blood pressure, at that time I do not diagnose them with hypertension or high blood pressure. It is elevated blood pressure. I would have to have 2 different blood pressure readings on different days in order to diagnose them with hypertension. Before we go further, I would like to classify blood pressure based upon the 7th Joint National Committee of Detecting and Evaluating and Treating Hypertension. This particular report included adults ages 18 and older, which I see in my practice. And when you look at the classes of blood pressure, a normal blood pressure consists of a top number, which is the systolic blood pressure of 120 or less, and a diastolic blood pressure, which is the bottom number you see, of 80 or less. Systolic blood pressure in itself is when the heart pumps blood out into the arteries. And a diastolic blood pressure is when the heart rests. So with a number of 120 over 80 or less, that's considered normotensive or normal blood pressure. Then the second class is considered what we call prehypertensive. Prehypertensive entails a systolic blood pressure of 120 to 139 and a bottom number, which is the diastolic blood pressure of 80 to 89. The third class is stage 1, and as we can see, stage 1 consists of a systolic blood pressure of 140 to 159 and a diastolic blood pressure of 90 to 99. The last and final stage is stage 2, and that's a systolic blood pressure of 160 or more and a diastolic blood pressure of 100 or more. So as we advance in the stages, which is patient-specific, individual, we see an increased risk of having target end organ damage because of an uncontrolled blood pressure.
So if a patient is considered prehypertensive after a couple of evaluations, what are the general recommendations or protocols for a patient in that category?
We would start with lifestyle changes, which targets diet and exercise.
Okay.
I always encourage patients, if they can give me 1 pound a week minimum, then they will be doing themselves a service.
Okay.
And their future a service.
Okay.
If they exceed losing 1 pound a week through diet and exercise, then once again I congratulate them and I continue to encourage them to do those things. Typically, I allow about 1 month after that to see where they're at, to see if they're making any changes for the better, and we go from there.
Okay. One of the things that my mother often says is that her blood pressure is never so high as when she goes into the physician's office to actually have it checked. So I think she has some sort of situational hypertension, but do you hear that from your patients too, that it's not typically as high as you think it might be?
I do. And what you're talking about is one of the common terms we call white coat syndrome, white coat hypertension. As you're speaking, the patients themselves have a normal blood pressure outside the office, and when they're there with me during their visit, their blood pressure, of course, is elevated. What I encourage in that case is for the patients to invest in a home blood pressure monitoring system where they can check their blood pressures at least once or twice a day for a week or two, and then either call me at the office with their logs or come in for a follow-up to discuss future plans for that.
Okay. And a home blood pressure monitoring system, that sounds pretty technical. Are those available pretty easily? Can they be come by pretty easily?
Yes, you can go to your local Walmart, Target, pharmacy to get those blood pressure cuffs.
Okay. And the cost for those, is that pretty?
Normally the cost range between $29 and $69.
Okay. So it's fairly affordable and really a good way to monitor blood pressure over in a more detailed way.
Absolutely, because what it does is it gives your physician an opportunity to look at what your blood pressure readings are outside the facility and what they are inside the facility to better manage your care. And if there are medications that you're using, that helps manage those as well.
Okay, very good. Let's talk just briefly. These numbers can be somewhat confusing, but a patient could go into their physician's office, and I'm sure the doctor would want to make sure that they understand what significance these numbers have. So their physician would be the primary source of information about their condition. Is that correct?
That's correct. It starts with making an effort to go in and see your doctor.
Okay.
Or find a doctor so that you can get an annual or a physical. And of course, you'll get a detailed exam with blood pressure, weight, etc. That would be done on that initial visit. And any subsequent visits after that if needed.
Okay. You're listening to the Canon Hospice Radio Hour. We're joined today by Dr. Candace Worsham, physician in Gulfport. When we return, we're going to be talking about some additional risk factors. We're going to talk about complications that come from hypertension, explore this issue a little bit further. We're so pleased that you joined us today. We will be back in just a moment. We want to welcome you back to the Canon Hospice Radio Hour. My name is Elise Spencer. I'm joined today by Dr. Candace Worsham, Gulfport physician, and one area of concern and specialty for her is hypertension. So, Dr. Worsham, let's talk a little bit more about risk factors related to hypertension.
Some of the things people should be looking out for when it comes to risk factors are, number one, history of current smoking. Number two is being overweight or obese, having a body mass index, that's BMI, of 30 or greater kilograms per meter square. Being sedentary, that means no physical activity. Also, having a history of elevated cholesterol, which is dyslipidemia, as well as a history of diabetes mellitus. Family history of cardiovascular disease, specifically intermediate family, women who are 65 and older, who've had a previous cardiovascular event, and men who are 55 and older. Again, another one would be hypertension, just having a history of hypertension.
Okay.
That's another risk factor. So those are the common ones. And last but not least, having protein in the urine, which shows signs that the kidneys may not be functioning as appropriately as they should be.
Are men more affected than women by hypertension?
I think it's a toss-up, really, in what I see in the clinic. You know, I see half and half women and men, all races, who are affected. So I don't think one is more effective than the other. It's pretty equal in the
Okay.
practice here in Gulfport. I'm not sure about other practices here or countrywide, but for my practice, I'm seeing both women and men.
Could you tell me a little bit more about certainly a history of smoking or a habit of smoking has a number of health implications, none of them good, but what's the link between smoking and blood pressure?
When you look at tobacco and the chemicals that are in tobacco, those chemicals stimulate our central nervous system. That's our brain and our spinal cord, which the nerves come out of our spinal cord and innervate our organs, which are made up of tissues and cells. When it stimulates the nervous system like that, it arouses it and it causes more vasoconstriction of those nerves and arteries. So in essence, just like stress that we have on the job or at home or in the church or wherever that we're active in, that in itself can elevate our blood pressure just by stimulating receptors in our central nervous system.
Okay. And the relationship between alcohol consumption and hypertension is something that I don't understand well. Can you tell me more about that?
What you realize is with alcohol, and that entails what we consider beer and liquor, those can cause us to have more of a glucose intolerance. And in terms, our cells, which make up our tissues and our muscles and organ systems, cannot utilize the glucose like it should in our bodies. That means it cannot. I always think of it as extracting the sugar or glucose out of our bodies to utilize it for fuel and energy. So we have a bunch of sugar that's running rampant in our blood vessels in our body. And when that happens, we have more of an increase in weight or adipose tissue. And where there is an increase in weight, that in terms affects how our blood pressure is regulated.
Okay. Would it be correct then with persons who have obesity issues that the heart has to work harder to get oxygen to the tissues? Am I understanding right?
Very good point. In our patients who are overweight or obese, it's a challenge because you have a lot more adipose tissue that lie on top of our organs. And in our chest cavity, we have our heart, we have our lungs, our liver, and other organs. So with the amount of pressure or force that causes upon those organs, yes, there's more oxygen consumption in everyday life living and workload for the heart itself to pump out enough blood to reach other organs and tissues and cells, because those rely on nutrients to survive. So in fact, if you're inactive, you're sedentary, you're doing yourself a disservice, and you're working twice as hard, and anytime the heart muscle itself works just as hard, then of course that heart muscle, which is made up of tissue and cells, is going to enlarge and get bigger and lead to other problems or complications.
Okay.
Like the target end organ damage we see.
Let's talk a little bit more about that and what the effects are on various organ systems in patients who have perhaps a long-term history of untreated hypertension.
Yes, what we see in patients who we classify as stage 2 is that the heart itself gives out. People develop myocardial infarctions, which are heart attacks. They develop unstable angina, which is simply chest pain. Their heart muscle increases or enlarges to where they have left ventricular hypertrophy, which is LVH. They even develop heart failure in itself because the muscle tissue of the heart cannot pump sufficient amount of blood into the heart because of the size of the heart. And then there's a difficulty sometimes with the blood leaving the heart to go supply those nutrients and oxygen to the other organs and tissues and cells. We see in the brain, many patients develop TIAs, which are transient ischemic attacks or strokes. In the kidneys themselves, we see renal failure. Patients end up on dialysis for end-stage renal disease, and or they develop chronic kidney disease. We see with the blood vessels, particularly the lower extremities, peripheral arterial disease, PAD, in patients who have uncontrolled hypertension, specifically stage 2 left untreated. In the eyes, we see retinopathy. So there's damage to those blood vessels that can lead to vision impairment or blindness. Those are some common ones that we see that involves our heart, our kidneys, our brain, and our eyes.
So we're really talking about a condition that affects all the vital systems of the body. And understandably so, then it's an important topic to visit with your physician.
It's a very important topic if the patients feel that they are at risk or if they have a strong family history of any of these medical problems.
Dr. Worsham, let's talk about what are termed secondary causes. I'm not sure what that is.
When you look beyond family history and some of the cardiovascular risk factors that I talked about earlier, there are other conditions, problems that can lead a person to having hypertension or high blood pressure. Some of the most common ones we see in practice today, especially in my practice, is patients being diagnosed with sleep apnea. Of course, these patients have other risk factors that lead them to sleep apnea. When looking at their weight, most of these patients are overweight or obese. They have a history of hypertension itself. They also may have what we call an anatomical variation in which they have more wider necks, more crowded oropharynxes than some of the other patients that I see. They may complain of snoring or not feeling as refreshed when they wake up in the morning time. Or their spouses may complain that, oh my goodness, they just snore all the time. It seems like they're not breathing. They stop in between and I have to nudge them to wake them up. You know, those types of complaints I hear.
That's so interesting because I'm certain that you hear a number of complaints about not getting a restful night's sleep from the spouse, and I guess I would think of sleep apnea being more of a respiratory or pulmonary issue. And so it's curious to me that can have some pretty serious implications on a person's blood pressure.
Yes, what you see is a work of two organ systems, the heart and the lungs. You know, the airways in between, as I would say. Yes, both work together with this cause, but one thing I want to make a correction on too is I mentioned that most are overweight or obese, but we are also seeing patients who are not. Those who are thin or normal weight developing sleep apnea. As we know, there are two types of sleep apnea. You have the more central, localized sleep apnea, and more of the peripheral, beyond the brain itself. So, in detecting which one you may have or have not developed, you would need an official sleep study, which is done through a referral from your primary care doctor, in which I've sent some of my patients for sleep studies when I feel that they are at risk for having sleep apnea, which does not benefit them if they have other risk factors or they have a history of hypertension. So, you know, that's one of the secondary causes of hypertension. And then you also have to take into account also of drug-induced hypertension. You know, during the springtime, some of the summertime, people have allergies and colds and sinus infections, and many of them purchase medications over the counter, a lot of the decongestants, you know, with the pseudoephedrine and those in it. And in fact, if they do use prolonged, you know, decongestants, that too can raise blood pressure and cause hypertension. So, and if they abruptly stop, it may have a rebound hypertension. So you have to be careful with a lot of the medicines over the counter. Make sure, you know, your doctor knows what medicines you're taking, because once again, those medicines can counteract with other medicines that you're taking.
Even the over-the-counter medications we need to make our physicians aware of.
Absolutely.
It's typical to think, well, if you can buy it over the counter, it's probably safe. for most people to take, but in fact, they can certainly complicate a health condition that you receive prescription medication for.
Absolutely. You, as a physician, wants to know every medicine your patient is taking, from prescription to over-the-counter to herbals to supplements. All are important to me, and I suspect all would be important to other primary care physicians as well.
So, as we go into our next segment, we'll be talking a little bit more about medications that are prescribed and some other effective strategies for treating hypertension and helping all of us to live a healthier lifestyle. This is the Canon Hospice Radio Hour. Canon Hospice is located at 1520 Broad Avenue, Suite 500 in Gulfport, just north of Memorial Hospital. For more information, call 228-575-6251. We'll be back right after this. Welcome back. We're about halfway through our segment this morning. We're so glad to have you joining us here. And as we continue our conversation with Dr. Candace Worsham, Gulfport physician. We're talking about hypertension today. And before the break, we were addressing some of the secondary causes of hypertension. There are a few others that we haven't yet covered. So what are those other secondary causes?
Some of the other ones include chronic steroid therapy. Steroids, in terms, can elevate blood pressure just by, it being one of the, I call synthetic hormones that we naturally produce in the bodies. In itself, it causes a lot of associated symptoms, such as weight gain. And as we were talking about today, weight gain can, be affiliated, associated with hypertension as well. It also can impair your glucose tolerance. So once again, if your glucose tolerance is affected, you tend to store more adipose tissue, and in terms that can cause more stress on the heart and blood vessels in your central nervous system. It causes hypertension. So chronic steroid use, as well as some tumors. There are some tumors that develop within the kidney itself. You may have heard of pheochromocytoma that can occur unilateral, bilateral in the kidney in terms of kidney function. Because in the kidney, we know it's a very vascular organ, both of those, with blood vessels, arteries, and veins. And anytime you have a mass within the kidney itself, it can cause a decrease in glomerular filtration, which is just basically the kidney filtering toxins, from the body itself. That, in terms with the impairment, can cause problems with blood pressure as well.
So really, we are talking about nothing in our body operating in isolation. One thing affects another, and that would be a reason why it's really critical for people to live as healthfully as they can, and stress must play a factor in that as well.
Absolutely. As a DO, an osteopathic family physician, it's important to consider the body as a single unit that has many parts. Structure and function cannot work alone. They work in sync. All the organ systems also work in sync. So consider every individual, every person, as a single unit with many parts working together for wellness, for good health. And anytime one of the systems is affected, then others will also be influenced. So promoting good health is one thing that's very important to realize for the people, for the population. And when you're dealing with hypertension, we must address more than just the heart. We must address the entire body as a single unit working in many parts. And in telling like I said, all the organ systems as one.
Okay. Well, it's a pretty easy thing to say to someone, you need to calm down or try to get your stress level down. But, there are a lot of us out there who are always in the checkout line behind the lady with 100 coupons, and the bridge on Pops Ferry Road seems to always be in the upright position when we need to get someplace. And, we're inundated with phone calls and texts and, so many sources of stress. What are some techniques beyond the usual, trying to relax, that a patient can use that's going to make a tangible difference in their health?
Well, some people are very spiritual, and for those who are, I would encourage daily meditation, daily reading God's Word for encouragement, for motivation through those tough times when you are caught in traffic, when you are on a job or at home, dealing with stressful people, which makes your world a little stressful. Also, I believe in the power of breathing. Without breath, a lot of our organ systems would go awry. Breathing works with our lymphatic system, our nervous system, all the systems that you can imagine in our bodies. When I speak of breathing, I speak of taking a moment of silence each day, whether you are caught in traffic or on the job or at home, maybe 5 or 10 minutes. Get into a quiet space, whether that be a designated room in your home, whether that be on your patio, or whether that be in your car with the windows up, and right now with the AC going because of the humidity here in our southern Mississippi. And closing your eyes. Again, I say keeping the radio, anything inside the car or the home as a distraction off. So close your eyes and taking a deep breath in. And when you slowly release after 5 or 7 seconds, release it all the way down and through your umbilicus, which is your belly button. Do that about 10 to 12 times. And see, don't you feel a sense of relief, euphoria? So that's the meditation part. It doesn't take long. It doesn't take long for the power of breathing. You can do it at any time of your day.
It doesn't cost anything.
Yeah, absolutely. It's free. It works. The other things you think about is physical activity. Whether you start it before you go off to work or school, or before you make that travel, that business trip, or after you get home, or while at work, taking time for you, taking time to do 20 minutes at least, if you have it to spare, or 30. Just get up a little earlier before you start your day. Make sure you stretch your upper and lower body. Isolate those muscles so that you won't injure yourself in the process. Do a little cardio, and if need be, a little strength training or weight-bearing training for those 20 or 30 minutes. Then eat you a nice breakfast. Again, with the foods, you want to stay high in fiber, a little bit of oatmeal, a multigrain piece of toast or a bagel. You want to eliminate a lot of fatty foods, a lot of high-fat dairy.
Oh, that's hard to do in this area of the country. There's so much good cooking going on.
I agree. We all have family, and some enjoy cooking like that, and at times, you have to say no. But in times that you don't say no, again, it's very important to emphasize and focus on physical fitness. We want to be a better Mississippi when we think of how we rank with obesity, cardiovascular diseases, compared to other states in our United States.
We're at or very near the top in those dubious distinctions, aren't we?
Yes, we're number one for obesity, cardiovascular disease, and other states that follow are Louisiana and Alabama.
Okay, so this is really a regional issue, not just confined to the state of Mississippi.
Yes, indeed. It is a local threat, a community threat, a state threat, a regional threat, and a national threat. We all need to do our parts in teaching and educating and encouraging in the office and outside the office, as us physicians, as well as those who have family members who are at risk or could be at risk. We all need to contribute to a better, healthier us. That includes myself and others.
it seems like there's so many times we know what the standard techniques are for reducing stress, but we almost get seized by the sensation of stress, and we stress eat, and we smoke, and we drink. We don't get enough rest. And what you're talking about is an opportunity to even make some small incremental changes that can boost our confidence, make us feel more refreshed and resourceful, and it's something that people can build upon.
Absolutely. What I tend to focus on a lot in my practice is wellness. Believing in yourself that you can make changes. You can become better. You can become healthier regardless of your circumstance. Whether it's pre-hypertension you have or whether it's stage 2, you can still make changes for the better. You can still halt any progression for the better, but it takes willpower. It takes saying that you can and that you will, and making those small steps forward through the encouragement of your providers and your family. So believing in yourself. As I was speaking of earlier, with physical activity, that alone can promote a better sleep at night. That alone can get you through your day while you're on the interstate, or if you're in the office, or wherever you are at. That can make a difference. You're less tired on the job. You have more energy. You also, as we mentioned, about the foods. There are certain foods that gives you a boost to start your day. You want to pile your plates with a lot of foods that are high in antioxidants. Those we talk about are your different veggies, whether they're green, orange, yellow, or red. Those are awesome antioxidants. Different types of nuts like pecans and walnuts, almonds that are not toasted or roasted or processed. A lot of different fruits that are high in antioxidants, like your blueberries, your raspberries. You focus on your different plums, your cherries, to name a few. Those simple little edible fruits you can pack along during your day, off to work, and you can snack on those between your major meals. That gives you a boost. The other thing you think about is including water in your diet. Simple things as water. For some, they want to add a little flavor, but just the simple, drinking of water is important versus a lot of your high sugar drinks and beverages and soft drinks and those things that only add pounds to your weight.
So water is important for hydration, especially this time of year when it's so hot outside and it's easy to overexert or suffer in the sun. But it's also important for being able to flush toxins out of the body.
Absolutely.
Okay.
Water is key to allowing, as you say, toxins to be released through the kidney, the renal system. You look at it having no preservatives, no sugars, no additives at all. I encourage water over anything. Second best would be those no sugar added fruit juices, like I speak of, like the cranberry or the pomegranate or the grape juice. Of course, I understand that some people can't drink those particular beverages because they may be on anticoagulants like Coumadin, because a lot of those beverages have vitamin K in it. So I encourage those who are on medicines like that not to drink beverages, but just focus on the water more so than anything.
No known side effects with water.
No, no, ma'am.
All right. Well, we are so glad to be here in the studio today with Dr. Candace Worsham. She is a physician in Gulfport. And before we go to break, Dr. Worsham, if you'll let our listeners know how they may contact you for an appointment at your office or ask a question about their health condition.
Currently, I'm located at 1924 30th Avenue here in Gulfport, Mississippi. Very conveniently located down South Highway 49 and US 90. Our office number is 228-863-7117. So if you have any questions or you would like to schedule an appointment with me, Dr. Warsham, please give our office a call, and I'll be more than happy to take care of you.
All right. This is the Canon Hospice Radio Hour, and we will be back right after this break. I'm Elise Spencer, Community Liaison for Canon Hospice, and this is the Canon Hospice Radio Hour. Welcome back. We're joined in the studio today by Dr. Candace Worsham, and the topic on board is hypertension. Do you have it? What can you do about it? And why it's important to make lifestyle changes early in order to prevent a whole host of other medical problems. So let's talk a little bit about medications themselves. When a patient goes on high blood pressure medication, is it a fallacy that if the person's blood pressure then returns to normal, they can get off of medication?
Well, looking at hypertension, as I previously stated, there are different classifications. And, of course, with patients who have normal blood pressure, I always want to focus on making sure they're physically active and they're eating the right foods and beverages. When it comes to prehypertension, again, we continue the lifestyle change from there, as well as to stage 2 hypertension. But as we look at the patients who are getting closer to stage 1, not really making much improvement with lifestyle change and physical activity with prehypertension, and they have risk factors or a strong family history, it may be important to implement at that point monotherapy. Mostly when we think of monotherapy, we talk about the diuretics, those particular classes of medicines which lower blood pressure, but they use the help of the renal system to lower the blood pressure. Things such as hydrochlorothiazide, chlorothiazide, Lasix. There are so many types of diuretics, but the one that comes to mind that was illustrated more so with the 7th Joint National Committee on Hypertension was the hydrochlorothiazide, starting at which at low dose is 12.5 milligrams. Then the highest dose is 25 milligrams, which studies beyond that doesn't show any benefit for lowering hypertension. Well, with the diuretics in particular, we have to be mindful that they need to be taken in salt-sensitive patients, and that in our elderly is very important not to over-diurese them to lower their blood pressure. Because most times with our elderly, as I say, as the population ages, so does the organ systems age, and they're not able to clear the medicine like they should through their organ systems. So they're more at risk for developing hypotension, which is low blood pressure, because of a volume depletion situation. The thiazides are very effective. The class of diuretics, period, are very effective in lowering blood pressure as a first-line agent, but you have to make sure you are monitoring certain blood levels. In particular, you want to make sure you monitor their renal function, whether it's once or twice a year when you're on those medications, because patients will lose potassium when they're on diuretics because it works on the kidney system in lowering blood pressure. So you want to make sure they don't become hypokalemic or even hyperkalemic based on the particular diuretic that you are using to lower the blood pressure. You normally, as physicians, speaking for myself, I'll start out with a diuretic first as a monotherapy agent if the patient needs it. And we will follow up periodically to see if it's making any effect in lowering the blood pressure in addition to lifestyle changes we talked about. Upon follow-up, when the patient comes back, if they're doing awesome, then that's wonderful. We will continue the efforts. I would keep a close eye on their renal function, likewise. And I'll ask them about potential side effects to the medication.
Okay. So you certainly see some patients in your practice, and we know of folks personally who have been prescribed high blood pressure medication, and there are reasons why they don't want to take it or stop taking it. What are some of the complaints that you hear as a physician?
Well, with the diuretic class of agents, one of the common ones is, "Doc, I'm always urinating. Regardless of when I take it, morning or night, I'm always up urinating." Is that normal? Well, yes, it's very normal because, again, it affects the kidney system in terms of lowering the blood pressure. Most patients who are on diuretics also complain of sexual dysfunction, not able to obtain an erection or keep an erection. But I've noticed it on higher doses of our diuretics, which leads to some of the other agents that we commonly use for high blood pressure, which is hypertension. If a patient does not do well with lifestyle changes and monotherapy with a diuretic, then as providers, we have to include an additional medicine. And therefore, with the additional medicine, there are other classes like your beta blockers. You think of atenolol, metoprolol, and others. And with the beta blockers, we see one of the most common side effects being, oh, doc, I feel so tired. I'm always fatigued. I have no energy. But in a lot of patients who are on beta blockers, they have a previous history of having a heart attack or a stroke, coronary artery disease. So the goal would be to use as less oxygen consumption as possible when you're on the beta blocker so that your heart does not have to work as hard as it once did. So there are benefits to the beta blocker class, but at the same time, you may notice that the patient may notice that they feel a little bit more tired than normal when they are initiated on a beta blocker.
Well, certainly fatigue and frequent urination and sexual dysfunction all impact a person's lifestyle pretty significantly, but physicians can work with, I would suspect, a pretty broad spectrum of options to try to mitigate some of those side effects and help people find a plan that works for them.
Yes, indeed. There are other options, too. You think of the class of medicines called ACE inhibitors. Examples are like the lisinopril, the Prenavil, the Zestoril, those. But you have to be very careful. What I've noticed in some of my patients, in particular some of our African-American patients that I have in clinic, is that they develop angioedema, which is swelling of the lips, the tongue, and the throat area, which can be very life-threatening and can possibly lead to death when they are on medicines like the ACE inhibitors. So you have to be very careful with that. I have not noticed that in any other culture or race as of yet. Not saying that it won't happen. It's just one of those things I'm very cautious about when determining what medicines are best for the patients and how they'll tolerate it. Other classes are like your calcium channel blockers you think of, like your amlodipine and etc. You have to be careful too when you're dealing with the calcium channel blockers. Again, you want to make sure there are no underlying heart diseases or issues. So quite typically when you are getting ready to initiate a antihypertensive medication, you want to do a EKG on the patient to make sure they don't have any underlying heart disease, heart blocks, those types of things, because the medications can be an adverse effect to starting patients on them if they have an underlying heart disease. So choosing the right medication will be determined based on just an initial EKG on what could benefit them the most and not put their life at harm's way. And you have other classes. You have your alpha blockers as well. The one thing you want to watch with the alpha blockers is, again, urinary retention. And you want to make sure of rebound hypertension. Let's say if they quit or stop without consulting you first on alpha blockers, they could get rebound hypertension. That could be life-threatening. So it's really critical if a patient's struggling with a medication or therapy that's been prescribed, not to do something independent of their physician's advice. They need to get in for an appointment and talk about the difficulties that they're having to explore some other options. Absolutely. And then another class that comes to mind is your angiotensin receptor blockers. You think about the Diovan and the ones in that particular class. You want to be mindful that at times, patients can have problems with those too, can develop some edema, the most common one. So you want to, again, ask your patients if they're having any problems with the medications that you initiate for their hypertension. And just ask them, do they have any questions overall in general? You want to educate them about the medicines and the side effects before initiating it with them as well. That's important to keep an open, line of communication with your patient, because you and that patient are in this relationship together and you're all trying to promote a healthier you. To really develop a strategy to maintain and enhance
your health and longevity. Okay. Well, just, this hour we've been speaking about hypertension, its effects, its treatment options, and as we discuss that topic, it seems clear that there are many things that can be done to control hypertension and in turn affect the function of a person's organs, heart, and really improve their lifestyle, their longevity. In general, though, speaking whether of hypertension or just any medical condition, what are some things that you advise your patients in order to get the most out of their visit with you? What do they need to do?
Well, first, the patient has to be willing to make change, because when I see them in the office, I'm ready to make the changes with them. So they have to be ready and willing to put forth an effort to make them a healthier them.
They need to be invested in their own health care.
Absolutely. I can only do as much as I can. I need them to meet me halfway so that we can work together to prevent a lot of the illnesses that are out there despite family history, despite risk factors already. Just trying to make sure that they set an example, not for just themselves, but for future generations, like their children and their grandchildren in the future, because we are role models for others. And so what we do, others think may be the correct way, may not necessarily be the correct way. We want to invest in our future, and our future is through our children, the future generations. We can make ourselves better, again, through lifestyle changes by eating healthier and staying active and fit. It's possible to make any change, whether small or big, just by making that first step. So I'm here to make that first step with you all in terms of fulfilling your goals.
The Southern culture is one that we love our food, our music, and we like passing our traditions on to a younger generation. And that's maybe grandma's gumbo recipe, but what you're saying today is that there's no reason to throw over those things, to keep them in moderation, and also to establish kind of a new standard. When you care for yourself, you're making an impression on those who are around you, and you may be inspiring someone else who needs to make a change, or helping your child adopt a more healthy approach to living.
Absolutely. I'm not telling anyone to throw away all the recipes that grandma or great-grandma have in store. We all have grandparents who have paved the way as top chefs, as I think. But, you can adjust, and you can change a few things in that recipe if need be. You can work out a little harder if you're tempted to continue the tradition. Just remember, anything can change. Recipes can be altered. Lifestyle period can be altered. It's never too late to change how you eat and what you eat.
Oh, such an important point.
Absolutely. It's never too late to get out there and just simply start walking to start. You don't need a membership for that. You can do it in your own community. You can go to your city community park. Grab a friend, grab a family member. Go out and do your 30 minutes or more. Chat along the way. You're burning calories and energy, and focus on eating healthier. That's the key in physical fitness. Those are the two that's going to get you a long way. And yes, at times you will need medications as adjunct therapy, but there are times when you can make such a difference that you don't need those medications anymore. You can simply have a normal blood pressure with lifestyle alone, but it takes effort, patience, time, commitment for you to do those things. And if you have that, you can make a better you.
What a great motivation you have for just adopting some simple strategies to control your blood pressure, manage your weight, and live a healthier lifestyle. This has been the Canon Hospice Radio Hour. I am your host, Elise Spencer, Community Liaison for Canon Hospice. Canon offers home hospice and inpatient hospice services within a 50-mile radius of our campus at Gulfport, 1520 Broad Avenue, Suite 500. Give us a call if we can assist you with any hospice-related issue or referral. The number is 228-575-6251. If you have comments regarding this broadcast or another topic that we need to discuss relating to healthcare, you can contact me via email at elise.canonhospicems@gmail.com. That's ALYCE.canon, CANON, hospicems@gmail.com. Thanks so much for joining us. Tune in again.